Hello, and welcome to this week's edition of the Hillingdon Hospitals podcast. In honour of Mental Health Awareness Week, which takes place from Monday the 13th until Sunday the 19th May, I'm here with Phil Pocock, he's a clinical psychologist, and Elaine Hodson, our health, wellbeing and engagement lead, to talk about the importance of raising awareness of mental health conditions, how to look after your own well-being, and some of the support that colleagues can access through the trust. So to start, would you like to tell us a little bit about yourselves and your roles at the trust? So Phil, would you like to take the lead?
Yeah, sure. Thank you. Yeah, I'm Phil Pocock. I'm a clinical psychologist and I run the staff psychology service in the hospital. So we're based in Green Acres, and our service, we're CNWL, so we're not part of THH, which I think is sometimes important for people to know, so that it's a completely confidential service. And people can come to us for some individual support, but we can also provide some sort of training and workshops for different departments. And we sometimes provide kind of psychological debriefs after people have been through some really difficult events at work. So we kind of offer lots of things, really. So yeah, if anyone is interested in what we can support, please do get in touch.
Fabulous. And Elaine?
Yeah, good morning, everyone. As you all know, I'm Elaine Hodson, Health and Wellbeing Lead, and I'm here mainly just to support the staff in which way I can.
Brilliant. So ahead of Mental Health Awareness Week, I think I've personally noticed that there has been a big shift over particularly the last few years and after the pandemic, with people having a bit more of an understanding of the spectrum of mental health and having slightly more open conversations. Um, why do you think it is so important that we keep talking about things like that and we pay attention to our own experiences?
Um, so I think it's important that we do keep talking about mental health and about all aspects of mental health, from anxiety, stress, mild depression, clinical depression, and I'm sure Phil has more experience of all of those syndromes. But the more we talk about it, the more open we are about it, the more people will find that they're comfortable to actually seek help. And we all experience anxiety and stress. Like today, am I going to get to work on time? So there's that bit of anxiety, there's a bit of stress, but it's stuff that we live with mostly.
I think, yeah, as I said, there has been more awareness, but I think there are still some misconceptions and people don't understand the full range of what people are experiencing. Are there any common misconceptions that you'd like to address or you want people to know more about?
Well, I think in terms of mental health, the World Health Organization would actually say that's about well-being. Often people think it's just about mental health, like diagnostic disorders, which isn't the case. We all have mental health. And I think in terms of misconceptions, I suppose if we think about it as a bit like a continuum, we can all move along that at different times of our life. So, I might be depressed at one point in my life, and then I might have other times when I'm doing quite well. So we can kind of move alongside that. And I suppose the point of that is that, mental health, we all have it, and poor mental health can affect all of us, and that can be impacted by lots of different factors. So it's something that hopefully there won't be so much stigma about, and I hope that that is changing in some ways, that we can talk about it and then get people the sort of support that they might need.
Brilliant. I think the theme of this year's Awareness Week is movement for mental health. So we already know there's quite a lot of evidence that being active can boost your energy, it can be good for alleviating anxiety, and is overall, we know it's good for physical and mental well-being. But I also know that particularly when you're struggling, the idea of exercise can sometimes feel overwhelming. And that quite often the things that you know are helpful are harder to do when you're not doing very well. Have you got any tips for people who want to start moving or know they need to make changes but might be finding it a bit difficult?
Yes, so most people in Hillingdon move. You know, they're walking around wards and they're up and down corridors. So a lot of people are moving already, which is brilliant. But some little tips for those of us that are stuck behind our desks for most of the day is little things. So if you come by public transport, get off one stop earlier and have that little extra walk. That's getting you moving. Dancing around your kitchen while you're making your dinner is another great way just to get moving. Go for a walk in the park. Anything that you can do to move is always good for your mental health. And if you do little steps, those little steps become bigger steps. And then before you know it, you could be running 5K or the London Marathon. Who knows?
So obviously we've covered movement. Oh, Phil, yes?
Sorry, yeah, if I could just add maybe from a bit of a clinical point of view. So I suppose if someone is really depressed, then it's going to be very difficult to do that. You know, I think we often know the kind of things that we should do, but it can be very, very difficult to do that. So I think it's often about just, first of all, you might need to reach out for support. You know, if people are really depressed, they might need some support along the way. And just start very small, kind of as Elaine was saying, and you want to kind of set yourself a goal that's very difficult to fail at. So, you know, if you do want to move more, then it might be literally just, you know, walking over to get a coffee and back, just something that's going to be very, very easy to do. And I think also, if you don't manage to do it because you're feeling so low, just trying to be self-compassionate and being kind to yourself and just, you know, allowing yourself to try again rather than kind of being very critical, which can then just add to your low kind of mood.
Yeah, there are a number of barriers that are in place. So, you know, it's like accessibility, time, money, body image, lack of open spaces. But anything that someone can do, even if it is just in your own home, to get yourself moving can only be a benefit, I think.
So we have just touched on movement. Are there other simple evidence-based things that people can be doing that will help with well-being and help with mental health?
Little things. You've caught me asked that for a question there, Anne. Just, I think one of the easiest things, and it can be a big barrier to people who live by themselves, but just having a conversation with a family member, with a friend, with your next door neighbour, with a colleague. You know, there are many people out there that you can actually, that are free telephone calls that you can just pick up the phone and say, I just need to talk to someone. So reaching out, I think, is, although a barrier, it can have so many benefits. Is there anything else that I think I haven't covered, Phil?
Yeah, well, I think if we're talking about just kind of well-being, I suppose there's lots of things that we might be able to do, such as you say, Elaine, connecting. I think that that's so important, you know, even at work when we're in very stressful environments and lack of staffing, and, you know, it can be difficult to take your breaks, but being able to just connect with the people you work with can be really helpful. And as we've talked about, keeping active, noticing the positive things as well, because often when we get very overwhelmed with stress, we sort of miss out on some of the good things that are happening. You know, our kind of minds are sort of wired to like pick up on all the negative things and dismiss the positive, but kind of consciously being aware of some of those things can be kind of helpful. I suppose when things are a bit more challenging, though, when we are talking about sort of depression that's impacting your functioning, or anxiety difficulties such as OCD or post-traumatic stress that are going to really impact how you're doing, I think there's probably no kind of soundbite things really. It's more about trying to get the appropriate help.
Brilliant. I think that one of the things that you touched on a bit earlier was some of the services for teams and actually wider groups. I think that's probably one of the things that people are least aware of in the trust. And we know that in healthcare environments in particular, people are often faced with very stressful and sometimes quite traumatic or upsetting situations. And because it's such a pressured environment, I think it can sometimes be normalized. Like, what should people be doing and what can people be doing to kind of help make sure that people are looking after their well-being at work?
So it's all right if I go,
Yeah.
Elaine. Myself and the staff psychology service at Chelsea and Westminster, we run a training session. So it's half a day on kind of supporting team well-being. So that's specifically for kind of senior managers. And that's online and you can book on through iDevelop. So that's one thing that we offer. More generally when some teams experience very difficult things, such as in, A&E or kind of ICU, sometimes we'll run, well, we call them sort of psychological kind of reflections, now team reflections, but or psychological debriefs to sort of help people with, how they've been managing emotionally following that, and kind of try and create some kind of narrative about the difficult thing that they've experienced. And also sometimes managers might come to our service just for a little bit of advice on maybe some of the things that they could do. There's also, Elaine, maybe you can talk to this about the Learning and Organisational Development Department. They're also quite active in supporting teams, and maybe you'll know more about that than me.
Not specifically about LNOD, but what we do offer in the trust is so many different things that people can tap into. So, there is field service, fantastic service. We tap into that all the time. You can go and talk to your GP, you can go and talk to your line manager, talk to your colleague. There's the free NHS therapy and counselling service. You can go through occupational health. We have the North West London Keeping Well service. And there's so many free apps available to staff, such as Unmind, Stay Alive, Bright Sky, Work Life Central, Headspace, and one that I came across just recently called Be a Mate. And it's a free texting support service, and it's mainly for the construction industry, but they have this wonderful free texting service for anyone that they can use, where they have trained volunteers that you can talk to, whether you're lonely, anxiety or stressed. So that's in my my newsletter for this month, for May. So there's so many things out there for staff to be able to tap into. You don't necessarily have to go through your line manager to tap into any of those. You can self-refer. I believe that's still the case, isn't it? For service.
Yeah, people can just self-refer to us. Yeah.
So no one needs to know if you don't want them to know. So, but I would say, please don't sit in silence.
Brilliant. Are there any final messages you'd like to leave people with?
Yeah, for me, it's, as I said, don't sit in silence. Know that we are here to talk. And if it is just to talk and have a coffee and a chocolate biscuit, hey, give us all a call. We're happy to do that. Please do reach out and just get some of the support that you need.
Yeah, I completely agree with what Elaine said, and I think it is just about asking for help, and I'd encourage people to do that, at the earliest opportunity, really, because sometimes, we leave things until it's just got so bad that it's harder to kind of get back up from. So yeah, I echo everything that Elaine said there. And I suppose if I can just say to access our service, you can just email thh.staffpsychology@nhs.net, and that's for any employee of THH.
And for me, Anne, you can text me, you can Teams me, you can call me, you can catch me in the corridors when I'm out and about.
Lovely. Well, thank you so much to both of you for your time today.
Thank you.
Oh, welcome. And what did I just say? Everyone have a great May the 1st, Sunday. I'm just going to say it. May the 4th be with you. It's Star Wars Day on the 4th of May. And have a good May.